Alright, so we are going to pick up with chapter 43 where we left off in class. So parasomnias, these are more prevalent in children. Whenever we're talking about sudden infant death syndrome, that's thought to be related to apnea, hypoxia, and cardiac arrhythmias that are caused by abnormalities in the autonomic nervous system that are manifested by sleep. So when we have our neonates, we want to make sure that they're in a supine position during sleep. Neonates up to 3 months old average about 16 hours of sleep a day. Infants sleep on average 8 to 10 hours during the night, and they take naps throughout the day. Toddlers sleep about 12 hours a day. After 3 years of age, children, it's stated in your book that children often give up daytime naps. Preschoolers sleep about 12 hours a night. Preschoolers often have fears, nightmares, and awaken during the night. Now, school-age children, 6 years old, they sleep about 11 to 12 hours. Now, once we get on to that 11-year-old age, they're sleeping about 9 to 10 hours. Adolescents are sleeping about 7 hours per night. Young adults are sleeping 6 to 8.5 hours per night. Insomnia is common for middle adults. Now, factors influencing sleep, we have lifestyle, we have certain drugs, not just abusing drugs, but prescription drugs, emotional stress, exercise and fatigue. Excess fatigue makes falling asleep difficult at times. Sleep talking can be caused by depression, stress, sleep deprivation, alcohol, and fever. Or it can be from a mental disorder or a seizure disorder. Now, moving on to chapter 44, pain management. We have 4 physiological processes of normal pain. We have transduction, transmission, perception, and modulation. So transduction converts energy produced by stimuli such as thermal, chemical, or mechanical stimuli into electrical energy. Whenever we touch a hot stove, for example, the impulse is sent and an action potential is created. Transmission of the pain impulse begins. So we have cellular damage that occurs, and that releases neurotransmitters, okay? The cellular damage that occurs results in a release of neurotransmitters such as prostaglandins, bradykinin, substance P, and histamine. Now, these either excite during transmission or inhibit during modulation. I do want you to read the chart on page 1015. Now, nerve impulses resulting from the painful stimulus travel along afferent peripheral nerve fibers. 2 types of nerve fibers conduct painful stimuli. We have myelinated A delta fibers, which are fast, and then we have unmyelinated C fibers, which are slow. A fibers send sharp, localized, and distinct sensations. C fibers relay impulses that are poorly localized, typically visceral, and persistent. So when we talk about perception, perception is the point at which the individual is aware of pain, okay? Once the pain stimulus reaches the cerebral cortex, the brain interprets the quality of the pain and processes from information from experience and knowledge. A reaction to pain occurs after the person perceives the pain. Modulation results from a release of those inhibitory neurotransmitters that hinder the transmission of pain and help produce an analgesic effect. Now, factors such as stress and exercise release endorphins, which can raise the point at which a person feels pain, which is also known as the pain threshold. I do want you to look over table 44-1. We have acute pain, we have chronic pain, and we have idiopathic pain. Acute pain usually has an identifiable cause, short duration. There's limited tissue damage and emotional response. Acute pain can also be a warning of injury or disease. Chronic pain has a dramatic effect on a person's quality of life. So arthritis, low back pain, headache, fibromyalgia, peripheral neuropathy, these are all examples of chronic pain diseases. Okay. Now, idiopathic pain is chronic and has no cause. I do want you to look over Table 44-2, as well as Table 44-3, and Table 44-5. Please look over Box 44-5. Now, characteristics of pain. We have characteristics of pain, timing, onset and duration, location, severity, quality. We have those relief measures. We want to know those aggravating factors. Please look at Table 44-5. Now, what are signs that someone is in pain? Moaning, crying, grimacing, clenched teeth, wrinkled forehead, restlessness, grabbing or holding a body part, avoidance of social contact, reduced interaction with the environment. Now, the universal pain scale is the Wong-Baker Facial Grimace Scale, and that has the smiley faces relating to the 0 level of pain and the crying face relating to the level of 10 pain. There is an outer scale, a numerical pain scale, and a faces pain scale. Okay. What are some non-pharmacological pain relief interventions? Just want you to think about that. Pharmacological interventions, we do have those analgesics, we have the topicals. I do want you to look over Box 44-13 and Box 44-17. And if you need anything, just send me an email.